A fresh case of the deadly pneumococcal meningitis has been recorded in Ofinso in the Ashanti region and in the Bono region also today, bringing the death toll to 32 from 142 reported cases.
This new strain is more virulent, so it's a bit more deadly, but then it spreads a bit less. So there is a good chance that the Ghana Health Service, working through the district health management teams and the region, can make sure that it does not spread as quickly and as widely as the traditional CSM would spread.
Though the figures appears to be increasing by the day, the Health Ministry is assuring all is under control to contain the outbreak.
Ghana Health Service, working through the district health management teams and the region, can make sure that it does not spread as quickly and as widely as the traditional CSM would spread.
The figures are scary and doesn't look like it's going away anytime soon. So what has the Ghana Health Service and Ministry of Health been doing all this while to curtail the spread of the deadly disease? Are we doing enough? If so, then why are we not seeing an end to it? Are we waiting for a national tragedy to wake us? Exactly what can you and I do to stop the spread of the deadly disease? This is today's big story. My name is Aisha Ibrahim. The Ashanti region is the latest to join the two regions that are already battling with the outbreak of pneumococcal meningitis. Just this evening, we are told there are fresh cases recorded also in the Bono region. But earlier this morning, the Deputy Health Minister, Victor Bampo, granted us an interview assuring us that the Ghana Health Service is on course in curtailing the spread and death of the deadly pneumococcal meningitis.
Found that as at this morning, there are 111 cases of meningitis with 28 deaths. It's affected 7 districts in Brong-Ahafo, Bole district in the northern region, and I think there's 1 case in Ofinso North in the Ashanti region. What has been done by the districts and the regional health management teams is that they have actually started public education of the people within the districts to ensure that people who have the disease identify it early so that they can come to hospital, because when they come to hospital early, then they have a better chance of survival. We found that for the most part, the organism that is causing the meningitis is not the normal one that we normally see around this time of the year, the seasonal, what we call the cerebrospinal meningitis. That is caused by Neisseria meningitidis. This one is a different strain which is caused by what they call strep pneumonia. So it's a different bacteria. And it's come about because a few years ago, the Ministry of Health and the Ghana Health Service undertook a widespread vaccination of the 3 northern regions. This means that the one that normally occurs in those regions has been suppressed, and that has given rise for this new strain to come up. This new strain is more virulent, so it's a bit more deadly, but then it spreads a bit less. So there is a good chance that the Ghana Health Service, working through the district health management teams and the region, can make sure that it does not spread as quickly and as widely as the traditional CSM would spread. Finally, from the Ministry of Health headquarters, we have provided, under the guidance and the direction of the Ministry of Health, we've provided funds up to the tune of 150,000 cedis. We've provided 1,500 vials of the drug that is required to deal with this organism. And also all the headquarters staff of the Ghana Health Service who are responsible for surveillance and for case management have gone up to the Brong-Ahafo region to monitor the progress of what is being done in those regions, to make sure that if there are any other things that need to be done to bring this under control quickly, then those things are done.
So the Bunahafo is now the hotspot for the outbreak, with 7 of its districts recording increase in cases. Let's do some analysis now, and we start with my colleague Anas Sabit, our regional correspondent, to update us on the situation. Good evening, Anas. Many thanks for your time on today's big story.
Good evening, Aisha.
And as what's the latest regarding the outbreak spread and death toll of the pneumococcal meningitis?
Well, Aisha, the Chiman, is one of the districts here in the region. And of course, I have been speaking to health officials in the municipality. And then they've been telling us that for the past 1 week, they've been recording more cases of meningitis. Looking at the number of recorded cases we have on Monday, which was 14 for both Chiman North and South. But as of today, the number of recorded cases here in the municipality, Chiman North and South, we have about 31 different cases with 7 deaths. But when I spoke with the Minister Health Director, what he has to tell me is that the increase in the number of cases is all as a result of the sensitization. It is creating more awareness to the health workers as well. Because earlier, before they began or before they undertook the sensitization program, most of them usually mistaking some cases to be other ailments when in reality they were meningitis cases. So the increase in the number of cases is all as a result of the sensitization they've embarked on lately.
You have been speaking with the people in the region. What are you picking? Do you have signals that the people now understand what the disease is? Or does it appear to you that education on the disease has gone down well with the people?
Yeah, the education is really, really helping. Honestly, most health officials, even within the region, initially were not even up to date about what meningitis is all about until recently. So the sensitization, the education is getting down on well with the people, and this is creating, the kind of needed attention that meningitis needs to be given. Initially, when I was speaking with the health director, he told me there might be even a couple of deaths earlier, which were as a result of meningitis, because health officials were not, updated on what meningitis is all about. They might have mistaken it to be other ailments such as malaria or other sicknesses. But kudos to the team, the health, directorate for the massive education and sensitization, work they've been embarking on. It's getting down on well with the people, and most people here in the outside of the region now know what meningitis is all about, what causes meningitis, and then how to, prevent ourselves from, getting the ailment.
This evening, we had information that there is fresh cases, or there are fresh cases in the region. Any update on that?
Yeah, exactly. There are a couple of other fresh cases here, and most of these cases here in Titiman are being referred to the Holy Family Hospital, which is the biggest, hospital here in the municipality. The health officer informed me that there have been another case, at one Opokwajman Hospital, which is also a private hospital within the municipality. So he told me that they are not quite alarmed about the number of, fresh cases, because getting fresh cases tells them that the health officials at post now know what meningitis is all about, and then the symptoms they are able to diagnose from people. So all they want to prevent is the number of deaths. So they are not alarmed in one way or the other with the number of, fresh cases. They want to try as much as possible to, get the few or the already existing cases, the people with the ailments being treated. So, Aisha, fresh cases are being recorded, but the health director is happy about that, because this shows how, up to date the health officials within the region are relating to meningitis.
Well, many thanks to you, Anas Sabit. We'll be coming to you for more in our subsequent bulletin. Let's come back to the studio where my colleague Matilda Homega is here. She's been on the beat And Matilda, you're welcome on today's big story.
Thank you.
What have you been gathering, or what have you gathered so far on this
pneumococcal meningitis? Exactly. It's a heavy name.
Right.
Yes. Aisha, from what I'm gathering, I just spoke with the Director of Public Health of the Ghana Health Service. I spoke with him a while ago, and it appears like each minute they are recording new cases. I've just been told that 20 new cases have just been recorded at Brong-Ahafo. I don't know the exact district or areas that these cases are coming from. Yes, but as we speak now, they are currently on the field trying to assess the situation to see how best they can help these people.
Right.
What the concerns they are raising now is that people are undermining the early signs that comes with this disease.
So they don't report
They
early
don't
to the
report
hospitals.
early to the hospital. So this is what is causing the increase in the death tolls that we are recording from Brong-Ahafo especially.
The death toll, we're told, is at 32 now. Can you confirm
it's 32 now, but we don't know. This was 32 as at 4 p.m.
As at 4 p.m.
As at 4 p.m.
What have your sources been telling you from the Ghana Health Service?
For now, they won't give details as to the death toll. Or
they want to assess the situation.
To assess the situation. But they also try, I understand that, because they're also trying as much as they can to reduce the panic that is coming with all this. But
So
people, of course, should be afraid of this disease, because you can't even tell. All they are saying is that when you start experiencing headache, stiffness in the neck and all that, you report to the health facility as early as you can.
Maybe they should do more detailed education, because stiffness of neck and headaches is something we've been experiencing all the time.
All the
time. So they may feel it's one of the normal headaches.
Yes, but
so
this is the time they are saying, if you live within that particular area and you are feeling this is when you have to report. If you get to the hospital and they tell you don't have it, it's good news.
Good news for you, but
it's
you don't
better
have to wait.
Exactly, you don't have to wait till it gets out of hands. That is what is causing the increasing deaths that we are recording from Brong-Ahafo region.
But from what they've been telling you, do you foresee an end to this anytime soon?
Well, you see, I can't really say that I see an end to this, because more people are at risk now.
Right.
Like I told you.
How many cases do we have now?
Let's start from us at 12 noon when I spoke to the Deputy Health Minister. He gave me 111 cases. 111
now
cases.
We're told
142
more people.
So it's now 142 cases with 32 deaths.
Okay.
But as at 12, to the same day, he told me 28 deaths. So you can just imagine, within just short period.
I mean, the space of how many hours?
Within 3 hours,
we have how many more deaths? About 4 deaths.
About 4 deaths to the...
That's very alarming.
Exactly. That's what I'm saying. We are not even too sure if these are all the figures they are putting
out.
But
the Ghana Health Service says they're doing so much, so we shouldn't fear, we shouldn't panic.
Well, from what I've been gathering is that they've started the community engagement with the people as to going to the area and then talking to them on the need to avoid crowded places and all that. Their room should be as airy as it can, and then they should some basic things for them to go about. One concern they also raising is that this area, a lot of people come in and go out of the area
and do business.
Exactly.
Right. So it's quite risky.
The first case was reported at the Tyne. Is it Tyne?
Tyne
Exactly.
Constituency, the famous Tyne Constituency.
Exactly. It was reported at Tyne, and then they thought the situation was under control.
Right.
Within a few days, it was in Winchi, Techiman, and now it's in 7 districts in Brong-Ahafo alone.
Brong-Ahafo alone, and like you said, people go in and out doing business, so the risk of the disease going into other regions. And of course, today we are told we've recorded 1 in the Ashanti region. Only God knows how many more we're going to record in the subsequent days. And even this is just a recorded one. How about those ones that have not been recorded?
Those who don't even report to the hospital.
It's alarming.
Exactly.
I think that we're still trying to get Dr. Bekwe, who is in the region. He is with the Ghana Health Service. He will tell us more about this update. We'll also try to go to the Ashanti region and speak to our correspondents and find out what exactly is happening in the Ashanti region. But Matilda, let's do more education. They said that when you hear you feel stiffness in your neck and you have headache, that's all you need to look out for to report.
These are the early signs. These are the early signs.
For instance, if you're living with someone who has this disease, or you happen to know your neighbor has this disease, I mean, you're not supposed to stigmatize. How do you carry yourself so you also don't get the disease? We know the infection, we're told this type doesn't the infection is slow.
So this type, what they are saying about this strain of meningitis is that
it kills quickly.
It kills quickly,
but the spread is slow.
The mode of spread, it's low.
The spread is slow.
When you get it, your chances of leaving
it's low. It's slim.
It's slim. That is when you don't report any. But when you get the needed medical attention and all that, there are people who survive. There were some cases, but they are now free and then going about the year.
Okay, so the issue has to do with is it like, for instance, Ebola, where you don't allow the person's fluid, or what do you do so you don't also get this disease from someone who has it?
What I'm gathering from them is that this is more airborne. It's airborne. That is why they are saying that we should try as much as we can to avoid overcrowded places. So that is one. I don't know the other details that come with it, because for them, they are not even giving you more details on it. So I wonder the kind of education they are doing out there for people to understand. Because even for me, that I have
for you as a journalist, you don't really know much about
it.
Tell me about the rural folk.
Exactly. How are they going to take it?
Who really is not even interested in all of this? I mean, how are they going to cope with this? I'm told Dr. Bekwe is on the phone. He's from the Ghana Health Service. Good evening, Doc. Many thanks for your time. Doc, we're told a number of fresh cases. Good evening to you, Dr. Bekwe. I'm told he lost him and he's back. Good evening to you. Thanks for joining us on today's big story.
Okay, thank you.
So we're told there are a number of fresh cases in the Bono Ahafo region. Can you bring us up to speed on that?
Okay, thank you very much. I think that since the early part of January, I think from the 1st to now, there have been reports of meningitis cases, particularly in the Tyne district, Wenche district, Techiman North, and Techiman Municipal, and then lately Kenny West. In total, we have recorded about 198 cases in this district.
198. How many were recorded today?
Today is only 2.
Only 2.
Yes.
And how many deaths so far?
So far, we have about 22 deaths. But I think that let me make some issue about meningitis. Apparently, meningitis is somehow endemic in parts of Ghana, particularly the northern part of Ghana, and then that's upper east, upper west, and northern Ghana, and then part of Brown region. So normally during the dry season, normally from, let's say, from October to March, where the weather is dry, you have low humidity, there are instances that you tend to have cases of meningitis being reported. So meningitis is not one of the diseases that you have one case and it's an outbreak. So almost every year we set up measures to try and contain such occurrences. This year, what happened was that the normal expectation is that they are common in the 3 northern regions. This one, the case started in time, and immediately the health officers went into action. But there's a challenge here. You see, the presentation of meningitis, it presents with a fever, you might have headache, you might have neck stiffness. So somebody typically will present to a hospital or a health facility and present like a headache, fever, and let's say neck pain. Unless at the periphery, I'm talking about a periphery at the lower centers, will normally go in for malaria. So before you realize the person is treated for malaria, and you're asked that you only don't get better after 2 or 3 days. And that has been the trend in this particular scenario. The cases, quite a number of them were seen at health facilities, at the periphery and were diagnosed as malaria. And then later on, we realized that it is more of a different diagnosis. So it's a challenge when we come to diagnosis of meningitis at the periphery. Because diagnosis of meningitis is actually when you do a procedure for a lava punch, and then you have to do a test to actually isolate the organism.
Dr. Bekwe, 198 cases in a spate of weeks. I believe this will mean strengthening your strategies to really deal with the situation, right?
Pardon?
I'm saying that 198 cases in a spate of weeks means that you need to strengthen your strategies to really deal with this situation. What's your plan B, or what's your backup plan?
Yes, I'm saying that the early cases were not, there was suspicion of meningitis was low. But for the past, let me say that for the past 1 week, whereby there's a clear diagnosis of meningitis being made and the organisms are being identified, we have heightened our surveillance system, and we have clear case definitions that now every health facility at the lower level particularly is now looking for a fever and a neck pain. So now we have a very sensitive case definition that will take the cases. And as I said, typically if you go to a Ghanaian health facility and you say you have a fever, you have a headache, you have a neck pain, the first diagnosis is malaria. So now that we clearly know that we are managing a case of meningitis or an outbreak of meningitis, the suspicion has been heightened and case definitions have been sent to all health facilities. And if you look at the incidence of cases over the period, it has actually drastically reduced. That's why I said today we had just 2 cases across the Brown region. And a part of Brown region that has not reported cases over the past 10 days. So we realize that the measures put in place, the difficulty is the early stage of identification, which is a challenge across globally. So immediately I want to take connect out that this is meningitis and awareness is heightened, then cases are easy to be detected and the management is setting.
Dr. Bekwe, you have said that this disease, the spread of this disease is actually slow, but 198 cases within a short period of time means it's very scary, isn't it? So
yes,
does it mean you are not doing enough?
No. You see, let me say that this burden that I'm giving to you was actually based on retrospective data that we analysis that we did. What I'm saying is that there were instances went to be the whole of this week. That's why I was offline. We had to go deep into the folders, and we realized that there were cases that were being seen as fever and headache and this is neck pain, and they were diagnosed as malaria. So now we realize that no, going back, all those cases were actually meningitis. So what the data I'm giving to you is based on what you have to go back, because clearly diagnosis of meningitis, you can have a differential as malaria.
Well, many thanks to you, Dr. Asiedo Bekwe. That's all time will allow us. We're grateful for your time on today's Big Story. We can now speak to Ofinso Municipal Health Director, Beatrice Appa. Good evening to you. Thanks for joining us on today's Big Story. Have we recorded any case in Ofinso?
Hello. I'm Beatrice Appa, the Municipal Director of Health Service.
Thanks so much for joining us. What's the situation in Ofinso right now?
Yeah, we had we had 2 confirmed cases with 2 deaths. And then there's other one with 2 specimens. We are still waiting for the results because we sent to the reference lab in Kumasi. We have embarked on massive education. We are even doing house to house, and we are educating the public on the case definition that has been given to us: fever, headache, and neck pain. And so this thing is going on. In all the OPDs, it is done in the morning, in between the day. Anytime we meet clients, we tell them.
Fever, headache, and neck pain. Is that all it takes to get this meningitis?
No, if you get a case like that, you should be suspecting meningitis. So you don't go straight away diagnosing malaria.
I want to know, if I'm living with somebody who has this disease, how do I protect myself from not getting it from this person?
We have done a lot of education. We are saying that if you experience the signs and symptoms, move to the hospital or the health facility.
If my neighbor has, what do I do so I don't get it from my neighbor?
If your neighbor has, you have to, when you get up in the morning, open your windows. Try to live in, don't be in an enclosed space. Come out in the morning, open your windows, move about freely, and then observe yourself for the signs and symptoms. And
So,
if you identify any of them, you have to move to the facility.
it looks like this thing is getting more scary because it's now moving away from the Bono Ahafo region, coming to the Ashanti region. What differently are you going to do to ensure, the cases in the Ashanti region is minimal?
In fact, we have well been sensitized, and I think every health worker now knows the case definition. And so that is what we are using. They have given us a simple case definition, and that's one nobody can run away from it. So if the community or the people are well educated, I think they will take it from there. And a lot of community nurses are in the system, and they are moving house to house. They are in their zones doing a lot of education. We in Offensive Municipal, we have drawn a plan where people are moving into churches. We are moving to places where people gather. Even today, a team went to the mosque in different communities in the municipal to educate the Muslim community. And Saturday, they will move into the SDA. Sunday, they will move. We are taking advantage of any gathering and giving the information.
Well,
We
many
have already
thanks to you,
sensitized
Beatrice
teachers.
Appa. Thanks so much for
Thank
joining
you.
us on today's Big Story. Many thanks for that information. Very scary. Having listened to it, we had one. Now she's telling us about two and two deaths. Well, how do you feel?
I don't even know how to describe it. You see, it appears
They're hoarding some information from us. I
Exactly.
know they don't want everybody to be scared, but I think that when people are giving the information, it can rather help us to plan.
Yeah, and this issue about the signs, the early signs of
It's not enough information to me
Well,
because you
it's
have
not-
stiffness of
it's
neck
not
and you have
enough.
fever and you have headache.
and you have headache, you need to report. You see, what they are trying to prevent is more deaths, because when you get infected with this, your chances
Of
it's
living
just
is
like
slim.
it's 50-50.
Right.
So immediately you start seeing the signs, you just need to report to the health facility. It doesn't take anything away from you when you report and you are told that you don't have it.
Then
It's
then
better to protect yourself
than to wait for
till
the last
it gets
minute.
out
This
of
is
hand.
today's Big Story. Many thanks to you, Matilda Omega. We've been talking about the pneumococcal meningitis, and it's becoming more alarming. That now we're told we have 198 reported cases, and the death toll stands at 32. We don't know if that's the 2 in the Ashanti region is included in this 32. Then we don't know where we're heading to. It's scary, and the advice is that if you have headache, stiffness of neck and fever, just report to the nearby hospital and get medical attention. Many thanks for watching. My name is Aisha Bai.